Welcome back to Healthline on Asia Telugu channel. I'm your host Varsha Singh, and again, I'm bringing another interesting presenter, a practitioner who is going to give us interesting tips which will help us to improve the quality of our life. This is a special series, as we all know. We are talking about medicine, which is not the mainstream medicine. Modern medicine continues to be the mainstream part of our life, where we continue to visit our primary provider, doctors, physicians, nurse practitioners, for our day to day need for our health. However, there is another branch of medicine which is considered complementary and alternative, natural, holistic, which can be used as a complementary therapy or as an adjuvant therapy so that we can use it to promote our health and also use it for our own well-being. So far in this special series, we have discussed many branch of medicine which is considered as a complementary or alternative. We talked about homeopathy. We had wonderful presenters who talked about the science and principles of Ayurveda. And today in our show, we have a practitioner who's going to give us a really good review about naturopathic medicine. We use this terminology as natural medicine and naturopathic medicine. So, but our concepts are not really clear. Do we really know when we use the terminology naturopathy medicine? Probably not. This is the reason I have invited Dr. Mansi Vira, a very young professional who is beginning her career as a naturopath. Her choice to become a naturopath has a story behind it. Without much ado or waiting, I would like to introduce Dr. Mansi Vira in this show, Healthline on Asia Telugu channel. Welcome, Dr. Mansi Vira. It's such a great pleasure to see you with us on this show, and you have decided that you will share everything about naturopathy medicine and take us through the journey that you have experienced and share some important tips with our viewers.
Sure. Thank you so much for having me. I really appreciate this opportunity and taking this time to, learn a little bit more about naturopathic medicine, what it's all about. And the question that you brought up, what is it? How is it different from natural medicine? It's a great question, and we'll go into a lot more detail really soon. So I'll maybe start with the journey, how I got there. So I think since high school, I've been interested in medicine, in helping people. I was always passionate. I am still passionate about changing people's lives in some ways. I also am a dancer. So I trained in classical Indian dance for, I guess, 13 years I trained, and then I continued to pursue that in college as well. So I majored in dance, and I also was pre-med. And I found that fascination of the human body, the dance, how it's healing for me, how it's therapeutic for me. And I wanted to combine it in some way in my practice of medicine. Of course, I didn't know how to at that point. Also, on the side, I've had my own share of illnesses. I continue to have illnesses right now too, and it was always interesting because I would seek help. I would get the allopathic side of things, but I never really recovered. I never really got there, that true healing. And sometimes, we don't find that cure. We don't find that true healing. Sometimes it's learning how to manage your illnesses in a healthy way. And that's where a lot of these naturopathic, natural approaches came into my life. I learned meditation at such a young age to help me balance out, the emotional aspect of the illnesses that I was going through. It made a profound impact, and I started teaching it in high school as well. And this passion I had to really integrate the two sides, the allopathic and the natural side, became the forefront of my, how I wanted to change people's lives and pursue my career.
You started somewhere experiencing those symptoms and personally you experienced how you were not finding the answers, and then you went ahead and actually decided that, I want to continue on this journey. I want to dance my way and heal myself, and I want to explore how there are other natural modalities that can help me heal myself. And now, as a naturopath, as a new naturopath, I wouldn't say brand new, but you have graduated about a year ago, I would say. And now you are on your path helping other people discover the same thing. So it's really interesting how sometimes we find our own calling through our own experiences. So that was a wonderful sharing. So let's talk about naturopathy, because every science, and you said you really didn't know about it, but you discovered it, you found it, and you pursued it. So let's explore the principles. How does it differ from other branches of medicine? What is naturopathy and what are the principles behind it?
Yeah, so naturopathic medicine is a distinct specialty in primary care. So we're all aware of primary care, family practice type of setting, but it's considered a distinct specialty that focuses on prevention and the body self-healing process. Of course, it's holistic, so we don't utilize just one modality, and where indicated, we will use medicine as well. Like the traditional allopathic medicine, but we treat both acute and chronic disease. And I can go into a little bit more of each of the principles, because I think this highlights how different it is than all the other modalities that we have out there, including medicine.
Of course, yes. So yeah, you said that there will be different ways of how naturopathy treats the body. So if you can just explain how many principles and how do you actually approach your patients when you are treating them with naturopathy?
Yeah. So there's 6 guiding principles that we have for naturopathic medicine. The first one is do no harm. So that we try to use the least invasive and the most natural therapies that we can. We don't want to do harm to the body. In fact, our whole goal is to help the body heal itself. The body is incredible, right? It has so much power to heal itself. If we get a cold, very often times we don't even need to take medicine for it. It'll just go in 2-3 days, right?
Yeah, it is. It is. Isn't it a saying that the common cold will get better in 7 days? If not, it will get better in a week.
Yeah, exactly. So, and we often don't even need to do anything for it. But if we give if we take some turmeric powder or give it some support, it might happen faster. And that's oftentimes what we do: give the least toxic, least invasive therapies to just start that support for the body to start healing itself. So the second principle is the healing power of nature. So it kind of connects to the first one that we just talked about, but we recognize that, the world is assisting our bodies. The body has its own innate wisdom, its innate capacity to heal. And we've seen that many a times, patients healing from chronic conditions, from things that didn't seem possible, and they are able to make a complete recovery. And that's because they allow that time. They're using different modalities, different holistic modalities, and the patients to adapt to a different lifestyle. Maybe it's changing some dietary habits, but the body is really capable of healing if we allow it to do so. So if we give it the right nutrients, the right food it needs, the right space, environment that it needs, it really can help facilitate the body's healing process. The third principle is identify and treat the cause. So a hallmark of naturopathic medicine is understanding and evaluating the root cause. So very often, we just treat the symptoms. And I think as a culture, we're kind of trending more towards that because lack of time, pressure from work or school that we can't miss out on these things. And people then tend to, just treat the symptoms. But what happens is we oftentimes just suppress the symptoms and we don't get to the root cause, the underlying cause of the disease. And the underlying cause may not actually be connected to the symptoms at all. So as naturopathic doctors, we have to put on our thinking caps and get our magnifying glasses to really see and discover the underlying cause. And we want to remove those obstacles to cure. So once we find the underlying cause, we then initiate our therapeutic plan. The next principle is doctor as teacher. So this is one of my favorite principles because I think it highlights how important having a team for your care, your healing team is. So doctors and patients are on the same team. We're on the same team, and we educate the patients to make sure that they understand what their disease is, why it's being caused, and what the plan is. Very often, we go to the doctors and they just write this medicine, here, take this. And they don't explain why. They don't explain what symptoms can happen, what side effects can happen. And I think it's so important for the patient to be educated fully on what's going on in their body and how we are going to address it and how we're going to be working on the same team together. That builds that trust, that educational aspect. It helps to really nurture that relationship between the doctor and patient. So I think it's one of my favorite principles because we get to be the teacher and the patient's team player. The next principle is treat the whole person. So kind of, this is another hallmark of naturopathic medicine as well. We look at the body as one united system and not just separate parts. So yes, you might be experiencing some digestive issues, but where is that really coming from? Are you anxious? Are you having some thyroid issues? So we look into all of it, the whole picture, and not just focus on the symptoms, because very often, if you're just treating one area, one organ, the others are not going to be balanced and they're going to be left out, and everything is interconnected. As we'll go into more detail too, with the case study, everything is interconnected. So really treating the person as a whole versus in parts is really important to restore the balance and total health. And then the last principle is prevention. So, why wait until things get really bad when we can be proactive and create a healthy lifestyle, healthy balance, be mindful of what we're eating, what we're drinking, what we're doing in terms of our activities, physical activity. So all falls under prevention. So it is better to prevent illness and suffering whenever possible, and that's the guiding principle that we use. So even if you're not complaining about a particular issue, we look at metrics, we look at what age you are and what risk factors you have, and start addressing them before they even start to come into effect.
That was a wonderful summary of all the 6 principles that you learned while you were in naturopathic medical school. And I'm sure, like, other than just having the healing property, like the self-healing property or our ability to heal ourselves, naturopathy definitely uses therapeutics because our body still needs help. Even though we can heal ourselves, there are conditions where we definitely need medicinal resources. So there are therapeutics in naturopathy. So if you can just explain, what does it mean? What are the therapeutics that you use in this branch of medicine?
Yeah, so there's so many therapeutics, and I'll probably cover just a few because there's really a lot that we have learned in medical school. So one of the main ones we use is called hydrotherapy, and it goes back to almost ancient times too. You know, hydrotherapy is a use of hot and cold, the manipulation of hot and cold water to facilitate healing processes. So it can be used for so many different things. It can be used for acute aches and pains or injury, or also more chronic things like Lyme disease or parasitic infections, or things that we're trying to pull out from the body, like toxins. So, you know, we use a wet sheet. We can use a cold pack, hot pack. And then also these hot tub baths with mud or other healing properties like different herbs, different herbal mixtures, and those are all used for different things. IR sauna as well, and that all falls under hydrotherapy. And it's super powerful actually to use that manipulation of hot and cold to start facilitating healing, like inflammation decreases, and we're moving the blood of like bringing more blood cells, white blood cells, to the area of, you know, wherever it needs healing, and we're able to facilitate that process there. Another huge part of naturopathic medicine is the use of botanical medicine. So botany, you know, it's a study in itself. There's so many herbs, and people are using herbs worldwide for a variety of illnesses. And we're trained, we actually have 4 years of training in botanical medicine, and we use herbs all the time because herbs are powerful, and actually they can be very powerful as medicine. And the thing to note here, though, is because they are sometimes so strong, we take a very accurate history of people's prescription medications, other supplements they might be taking, because there can be interactions sometimes. But for the most part, luckily, they are safe and non-invasive, but also very potent. They can work really well, really strong. So botanical medicine is one of my favorites. We also have physical medicine. So, you know, that can be like the adjustments that chiropractors do. So we call it naturopathic manipulation, or it can be, you know, a lot of what physical therapists do. So using like the stim, ice pack, hot pack, things like that. So it's like more of that physical, you're using your hands essentially, but we're trained in that as well. Clinical nutrition, of course, that's one of our standards. We're trained for 4 years in clinical nutrition as well. It's something that, you know, there's so many nutrition theories out there, and we kind of help to formulate a customized nutrition plan for you, what works for you, because very often what works for one person doesn't work for another person. And that's really important to understand. That's why naturopathic medicine is very customized to the individual we're treating. Homeopathy, again, is another part of naturopathic medicine. It's not something that, you know, everyone pursues after they graduate, but it's really helpful, and our training in homeopathy helps to really bring together this holistic aspect of naturopathic medicine. We're trained in counseling as well, and Eastern medicine, therapeutics like Chinese medicine and Ayurveda, and we do have pharmaceutical intervention training as well. So we have 2 semesters of pharmacology in our medical school curriculum.
Wonderful. It sounds like naturopathy is mostly like an integration of existing all holistic modalities. So when I was listening to you, I was thinking you are using the herbs and botanical resources, which is most likely and similar to Ayurvedic medicine, but you are also incorporating physical manipulation, which is chiropractic. And also then you are using hot and cold, the hydrotherapy, which is also which is used in day-to-day treatment modality, physical therapy and occupational therapy. And then you also mentioned the homeopathy and counseling, which is also addressing the mental health. So naturopathy sounds like a combination of all those natural modalities which are currently being practiced all over the world. And so you are kind of given training to learn about everything. So when patient comes to you, you can use either one or all of them, correct?
Yeah, exactly. And that's where the beauty of naturopathic comes in. There's so many different options, but we also look at the individual. We get a sense of what they might also be receptive to, and we customize our plan towards that individual.
Mm-hmm. So almost like holistic. I'm using the word holistic not as H but WHO, which is considering the person as a whole. So when you do your assessment, when someone comes to you looking for help, there must be a specific way of making that assessment from head to toe, inner and outer. So if you can go over that assessment part.
Yeah. So, for example, my first intake, so my first consultation is 90 minutes because I ask so many questions from head to toe, like you said, asking for the previous medical history, family history, any supplements or medications you might be on, and then do a really comprehensive review of systems. So right now I'm doing all virtual visits. So, the physical examination is not possible. It also depends on the state that you're practicing in. In all states, we're not licensed equally in all states, so that depends where we are to do the physical exams. But we do a very, very comprehensive first initial intake because we want to get to know you head to toe, your previous history. We ask mental health questions, social, emotional health, all of that essentially. And based on what we find that comes up during that first consult, we customize a treatment plan that carries forward for 3 to 6 months or longer, depending on the complexity of the cases or, the health challenges involved.
Wonderful. So I have noticed in naturopathy, there is a lot of focus on the gut health. Gut is, I want to explain in common man's language, as our stomach and intestine. If they are healthy, we are healthy. So what are the 8 typical signs of gut health, and what indicates that whether our stomach and intestines are healthy or they are not healthy?
So that's a great question because it seems like gut health is the trend today. And yeah, so, we often think if if we have diarrhea or constipation or gas or bloating, like that's the only indication that our gut is not functioning correctly. But there's a lot of symptoms beyond just those traditional obvious ones that indicate that the gut might not actually be functioning properly, because the gut is connected to the whole body. Research shows that more than 70% of the immune system is in the gut. Research also shows that more than 70 to 90% of the serotonin that goes to the brain is also found in the gut, so that there's this huge gut-brain connection. So other signs that indicate poor gut health include joint pain, chronic fatigue, mood changes, poor immunity, brain fog, acne or skin rashes, vitamin and mineral deficiencies, and migraines. And these are just a few. There's others too that can indicate that, hey, there might be something going on in the gut that we need to address first.
Wonderful.
Is test prep nerve-wracking? Getting an excellent score a huge challenge? A new wave in the test prep is here to help. Test Prep Pundits has all the answers to your questions. It is a one-stop solution for all your academic needs. Our premium online interactive content has hundreds of SAT and ACT test problems, hundreds of hours of videos. Get real and instant results with real scores on the real SAT and ACT tests. Our pundits are experienced and extensively trained in SAT and ACT prep.
What next? Join our free boot camp on June 19th and 26th, the free mock test.
న్యూజెర్సీలో ఇల్లు కొనాలని కానీ అమ్మాలని కానీ అనుకుంటున్నారా? మీ నమ్మకమైన నేస్తంగా మీ ఇంటి క్రయ విక్రయాలను చేసి పెడుతోంది మీ లోవి రియల్టీ గ్రూప్. వేలాది డాలర్ల మీ కష్టార్జితాన్ని, ఎంతో విలువైన సమయాన్ని ఆదా చేస్తూ కేవలం $990 నామమాత్రపు ఫీజుతో ఖచ్చితమైన సంతృప్తికరమైన లావాదేవీలను చేసి పెట్టే రియల్ ఏజెన్సీ లోవి. అంతేకాదు, మీరు కొన్న ఇంటి మీద మినిమం 1% క్యాష్ బ్యాక్ మీ క్లోజింగ్ కాస్ట్ లో పొందగలరు. మరిన్ని వివరాలకు ప్లీజ్ విజిట్ www.lovihomes.com. కాంటాక్ట్ 9083049621 or 9083371289.
If you're thinking of buying jewelry now and don't want to step outside, relax. All you need to do, call us. On the day and time of your convenience, we will bring our collection to you. Welcome to the Malabar Gold and Diamonds Showroom online experience. Step into your world without stepping out. Now that's our promise. Malabar Gold and Diamonds.
ఇది మా హీరో అల్లుడు కోసం ఫిట్గా ఉంటుంది.
పర్ఫెక్ట్గా ఫిట్ అవుతుంది. ఇది మైండ్ డైమండ్, 100% క్వాలిటీ.
సార్, ప్రతి మైండ్ డైమండ్ న్యాచురల్. ఇంకా మేము 28 క్వాలిటీ టెస్ట్లు చేస్తాం.
28 టెస్ట్లా?
ప్రతి డైమండ్ జ్యువెలరీతో పాటు ఇంటర్నేషనల్ ల్యాబ్ సర్టిఫికేట్ కూడా.
కళ్ళు మూసుకుని మీ హీరో కోసం వజ్రాలను తీసుకోండి. ఇది మలబార్ ప్రామిస్.
అవసరంలో ఉన్న పిల్లల సహాయార్థం సాఫ్ట్కిన్ సంస్థ నిర్వహిస్తోంది సాంగ్ ఫెస్ట్ లైవ్ స్ట్రీమ్ కాంపిటీషన్.
సామజవర గమన నేను చూసి ఆగగలనా, మనసు మీద వయసుకున్న అదుపు చెప్పతగునా.
నా వసంతం నీకు సొంతం, నా సమస్తం నీదే కదా నిస్తం.
మబ్బులోన వాన వెల్లులా, మట్టిలోన నీటి జల్లులా, గుండెలోన ప్రేమ ముల్లులా దాగినావుగా.
ప్రముఖ సంగీత శ్రేష్ఠుల సమక్షంలో టాలీవుడ్ మరియు క్లాసికల్ సింగర్స్ కు ఆహ్వానం. ఫైనల్ కాంపిటీషన్ 19th June 2021. వాచ్ లైవ్ ఆన్ టీవీ ఏషియా తెలుగు. అనాథ పిల్లలకు అందమైన జీవితాన్ని అందించండి. వారి చిరునవ్వుకు సాక్ష్యంగా నిలవండి.
ఎక్స్చేంజ్ 8,000 రూపాయల బ్యాలెన్స్ మ్యామ్.
ఇవ్వనక్కర్లేదమ్మా, 8,000 మీకే వస్తాయి.
ఎస్ మ్యామ్, మేము కేవలం హాల్మార్క్ 916 గోల్డ్ నే అమ్ముతాం. ఇంకా మీకు దొరికింది 100% ఎక్స్చేంజ్ వాల్యూ.
క్వాలిటీ, ఇది మలబార్ ప్రామిస్.
I just wanted to clarify for our viewers when we meant the gut secretes serotonin. Serotonin is the hormone which makes us feel good. So feeling good hormone, that's what Dr. Mansi talked about, is most of 70%, correct? 70% is secreted from our stomach and intestines, from our gut. So we really need to keep them healthy. To just understand how naturopathy has worked and how Dr. Mansi has taken naturopathic consultation to treat her patients, let's go over some case studies with her. And I'm sure she has some interesting cases that she can share with our viewers here.
Yeah, so I'm going to share one example of like looking at the whole picture, the whole body, right? There's a patient who had come in, 31-year-old female. Her TPO antibodies were at 115, her thyroglobulin antibodies were at 48, and TSH was normal at 136. So she has high antibodies for thyroid, but her TSH was still normal. She comes in complaining of fatigue, brain fog, hair loss, tinnitus, difficulty losing weight, anxiousness, night sweats, cold hands, and cold hands and feet. So a lot of these symptoms that she came in, yes, they are typical of hypothyroid, but also there's other things mixed in here as well. So her thyroid ultrasound had shown slightly heterogeneous multinodular thyroid. Her mother has a history of Hashimoto's, and she came in with a diet of being vegan. Prior to that, she was not vegan. She was consuming dairy and gluten, and I'll tell you why these are important in just a bit. Her stress level was really high at 8 out of 10. That's pretty high stress. It was due to work and graduate school, and she was also going to be getting married in a year. So we did further, so for her, we looked at as a whole, the whole picture, looking at her diet, her stress, her energy levels, and not just focusing on the thyroid symptoms. Of course, those were the main ones that we wanted to treat, and we knew that something was going on in the thyroid despite her TSH being normal. So we did further testing. We did an IgG food sensitivity test. So something that a lot of naturopathic doctors do are functional testing. They're more private testing. It's usually out of pocket because these are private labs testing for functional markers. So one of these functional tests is food sensitivity test. It looks at the IgG versus IgE, which is the classic allergy panel that we do. IgG looks at the food sensitivity or gut sensitivity, what I like to call. So it looks at how your gut is responding to foods. So we did that testing, and we saw some foods that she was sensitive to. And these tests, of course, break down these sensitivity panels to like high sensitivity, moderate, and low. So we had her eliminate the foods that had come up on the high test results. And then we also did a whole gut protocol. We did a 4-point cortisol test too, because she was feeling so fatigued and out of energy, and her stress was really high. We figured that there will be some adrenal component to her case. So in terms of what else we recommended, so in addition to that elimination diet I was talking about, elimination diet essentially means that you're rotating out foods and kind of keeping a log to see how you feel after. So the idea behind this is if you're eliminating the foods that you're reactive to or sensitive to, and you eliminate them for some time and then slowly reintroduce them in a very organized way, the hope behind it is that you'll be able to consume it and your body won't be as reactive. Of course, that involves some gut healing. We have some supplements that we use and some botanicals and some lifestyle adjustments too that we give for these types of cases, and anything to do with the gut really. So other things that we suggested for her diet included prebiotic foods, increase her water intake because she wasn't drinking as much water. And we know that water can help to just eliminate toxins. The hydration is important for all cells to improve energy as well. Avoid goitrogens. So goitrogens are foods that interact with the uptake of iodine. So for the thyroid, and the thyroid really requires iodine to make the thyroid hormone. So we had her avoid goitrogens. That includes things like raw broccoli and cauliflower, and a whole list of other vegetables. And then also to eliminate gluten, because there's a strong connection. Research does show that the strong connection with gluten and Hashimoto's, that antibody production, so that creation of the autoimmune response. Also, because she was so stressed because of work and graduate school, I think one of the things that I really wanted to focus on her with was breathing. So just taking that time, 5 to 10 minutes in the morning and at night, to do some deep breathing to really balance out her sympathetic and parasympathetic nervous system, because hormones are all connected. So when thyroid is off, these epinephrine and norepinephrine are being produced more than the parasympathetic response, things are going to continue to stay out of balance. And then the adrenal gland is really important in a player in all of this. So really balancing out those adrenal gland hormones. And then we gave her some specific supplements that I won't mention here, but they're specific supplements for the thyroid gland, the adrenal gland, and some gut support. So over time, I think we were with her for 6 months. Her symptoms began to improve. Her thyroid antibodies, that was kind of a byproduct. Her thyroid antibodies started to decrease as well. I think by the time we were transitioning out of our semester, her thyroid antibodies were very low, like I think 50, which it was over 115 at that time when we first started. But she had lost weight, she had no tinnitus, she had more energy, she wasn't as fatigued. Her night sweats and her cold hands and feet had completely gone away. And this was all through these lifestyle factors. Of course, we had supplements, but a lot of the things that we did, we kind of approached it as a holistic picture and kind of treated each thing as a system of a whole versus each thing as a separate functioning part. So that it was very convincing for me, and also just really nice to see that by addressing all these different components, and especially that mind body, that breathing element should help balance out the adrenal response, to help balance out her stress, really made a difference and helped her overall in where we wanted to see her. So she was really happy with the progress that she was really making. So that was nice for us to see as well.
That was a nice case study. I just wanted to break it down for our viewers who may not be from the medical background. When we talked about treating the thyroid antibodies, now everyone knows what is a thyroid. Thyroid conditions are very common, so that's understood. Adrenals are the one which are usually on our kidneys. These are the glands which produces cortisol, which is also considered as a stress hormone. So it seems like through your treatment, and you provided her very specific supplements which were meant only for that patient. It again brings to the same principle of individualizing the treatment part, where not all supplements are for everyone. And that's why they need to have a special consultant, a naturopath, or anyone who practices complementary or alternative medicine to provide that expert advice to that particular patient to get maximum benefit of that therapy. So thank you for sharing the case. 31-year-old, I'm sure she must be feeling great now through that naturopathic treatment. Is there any other case study that you would like to share with us?
I had one more patient, which I thought was it's a good case study to share, to just give a lot of hope that, like, by really simple things, utilizing very simple things, you can make a profound change. 61-year-old female came to me with hip bursitis and lack of energy. So I asked her again, we ask your diet, how much water you drink, as you saw, so many questions, your stress, your energy levels. So through that, I learned that she was drinking only 2 glasses of water. She wasn't really eating any vegetables, and she wasn't doing much for her pain, but because of the pain, she wasn't as physically active as she used to be. She used to be a runner and run marathons and things like that. And now, because of her hip bursitis, she just kind of wanted to give up on all things physically active, and which we know is also not good. We all need to be physically active, and it's good for our mental health as well. The dopamine boost that we get from activity is important too. So looking at that interconnected piece, that she's not feeling as happy, she's fatigued, and she has this pain. and she's not drinking a lot of water. One of the first things I recommended to her was increase your water uptake to like at least 5 to 6 glasses, eventually more. And I gave her some supplements, which, you know, are anti-inflammatory, like turmeric and other specific supplements as well. And I requested one, like we work on this food journey together. So how can we increase the fruits and vegetable intake to increase our antioxidants, increase the nutrition or nutrients that we gain from foods like vitamins and minerals, fiber, all of that. So, you know, just in 3 weeks of kind of starting this process of these very simple, small changes, she comes back to me saying, I'm running every day. And I was kind of taken aback that like, wow, her pain must really have decreased. And it just goes to show like even water, right? It's so important for eliminating toxins, for decreasing that inflammation. Water pulls out a lot of the stuff that we don't need in our body and really helps to get rid of it. So it's one thing to pull things out of the body, but it's also equally important to get eliminated healthfully from our body. So that was a component that I was kind of surprised myself. And she said she has so much more energy. Her sleep improved without really working on her sleep. So it was kind of like a multifactorial impact by making these simple changes. And of course, you know, when you're eating fruits and vegetables, like the healthy things that are given by Mother Nature, we feel energized. We'll have more energy. We have more fiber. Our digestion is a little better. So it kind of has like a domino effect on so many areas of our life. So yeah, that was something that I wanted to share because it was really those simple changes that made a profound impact.
That's a great story. Think about a marathon runner and not able to run because of pain, and now just making those simple changes. Now, again, it sounds like these are such simple changes, but it came through your thorough assessment and evaluating that case, analyzing, and then coming to that conclusion that this patient needs increased hydration, change in diet, and anti-inflammatory supplements, etc., etc. It really makes sense why anyone should be consulting rather than just picking up a supplement on their own or just reading on social media. Because everyone has different needs. Thank you for sharing that case. So now the most burning question, like, so I know that everyone needs individual supplements based on their personality type, physic type, what they're missing in their diet, or what kind of physical complaints they have. How about some common supplements? No matter what, it can be generally added to the daily vitamins so that it improves the overall well-being. It doesn't need to have a diseased condition, but as you said, that prevention is part of one of the principles. So if you can share those supplements which can be really beneficial for everyone.
Yeah, so I recommend a very good, clean multivitamin. I think everyone can benefit from that. I do tend towards plant-based multivitamins and vegan. So of course it's going to be plant-based. Just to get, you know, if you're not eating well or you're not able to eat well, I think just having that added boost is really important. If you don't take the multivitamin, then I think a B, like a multi-B vitamin is good. So it has all the Bs. You know, the B vitamins are so important for all the functions in our body, I want to say, including the brain functions. And also the B vitamins work synergistically with minerals like magnesium. So that's the third one. I would say if you're, you know, magnesium as a whole, I feel like most of us are deficient in magnesium in some capacity. And magnesium is one of those cofactors that are required by, you know, so many enzymes, enzymatic processes in our body, for our brain, for our gut, for overall health. So I think magnesium can be something that, you know, you can take and there's no harm really. Of course, there's so many types of magnesium, there's different forms. So consulting with a doctor, again, is important just to make sure you're getting the right one that you might need. And then anti-inflammatories if needed. I think we all, you know, as Ayurvedic background, we know of turmeric and ginger. Those are powerful anti-inflammatory, also like when you're sick. So it'll help when you're sick. It'll help with pain. It'll help with inflammation. A lot of these herbs, that's the beauty of these herbs, have impact not on just one system, but on many different systems too. And then having something like omega-3. So I know vegetarian and vegan forms are harder to find, but they are available. Or just being mindful of like eating avocados if they suit you, or adding olive oil on top to foods, but not cooking with it because it's not healthy to cook with some of these oils. But adding avocado oil, olive oil to your foods, just to bring in that extra omega-3, and chia seeds, flax seeds. Of course, everything might not be suited to everyone, but these are things, food as medicine is so powerful too. So oftentimes I do recommend eating more of these foods versus taking the supplements, just to have your body be able to absorb it better, more naturally. And, you can build your healthy lifestyle around this too. It takes small, simple steps, but it can go a long way.
Absolutely. So can you say a little bit about Quercetin? We are hearing so much about this supplement. What does it do, and why someone should add it to their daily supplement list?
Yeah, so quercetin, we use it a lot for allergies, like allergy season. It's a mast cell stabilizer. So when we have allergic responses going on in our body, there's a whole reaction that happens. It's like a complex reaction happening all at once. So there's a lot of histamine that's being released. And histamine is what actually causes us to have all these, like the teary eyes, the sore throat, inflammation, cough, all of these things is often triggered by histamine. So when we, you might be familiar with antihistamines over the counter, like Claritin or things like that. So this is more of a natural supplement that helps to stabilize the mast cells so they don't release that histamine in crazy amounts throughout the body.
Mm-hmm.
And quercetin is a bioflavonoid also, so it's an antioxidant. It helps to prevent free radicals in the body. So it's kind of doing those two functions at once. We can think of it for anti-aging, but it's more so as a bioflavonoid, super potent in its antioxidant properties. So it's something that we can also get from eating apples or onions, but in higher amounts, of course, when you're actually dealing with acute allergy or acute symptoms, it can be super powerful then too. It's also being used for glaucoma for people suffering from that because it helps to stabilize the blood sugar and has that effect on insulin as well. So there's tons of research out there, but like I said, the power of these supplements or botanical medicines is that they not work only on one component of the body, but often multi-factor. So it really does have a profound impact.
Thank you for sharing that. And the next one on my list is something that everyone may not know about it, and that's bromelain. And I believe it comes from a very humble fruit, pineapple. So if you can tell a little bit about that too.
Yeah, so bromelain, it comes from the pineapple core. So not the actual fruit, but the part that we often don't eat. It's found in the core. It's a powerful anti-inflammatory agent. So we use it, for allergies also, but also for people with chronic bronchitis or if they have inflammation in the chest. So it's a powerful anti-inflammatory agent.
Wonderful. So we learned a little bit about supplements that everyone can take. And when you say every form of vitamin B, it's the B complex form of that multi-B complex that someone can take. And then earlier in the interview, you mentioned that naturopaths are trained for botanical products, which are herbs. So what are those? Because summer season is here, spring is here, everyone is growing something in the backyard. There are definitely some herbs that we can grow in certain parts of United States. And typically in tropical countries like India or Caribbeans, they can probably have it throughout the year because they are blessed with sun. So if you can give us a kind of a list of herbs that you must have or you can consider having this in your pantry?
Yeah. So that is a great question. And I feel like it's hard to answer with just a few herbs because it's also like what you like. Because all of the herbs have therapeutic properties, but I love the Italian seasoning herbs, like growing fresh basil, thyme, even mint, lemongrass, tulsi, holy basil. It's one of the most powerful adaptogens too, that helps with the adrenal gland response and cortisol. And those are things that we can grow here. Of course, like you said, it's more seasonally than in India. But lemon balm, it's one that helps to calm the nerves, calm the nervous system. Passion flower, hops. I know hops is more known for the beer, but we have magnolia trees, chamomile, oat straw, lavender. All of these things I think can be grown here, and you can make your own botanical garden. People take these herbs in different forms, right? So we have the pills. Those are more potent in terms of like the concentration is a lot higher. So if you're experiencing something acute, maybe that will be better for you for maybe temporary time. But you can also drink many of these as teas. So you can make infusions, boil water, you can dip those herbs right in there, boil them, and then strain and drink it as a tea. Hibiscus also is a nice summery herb that has a really profound impact on blood pressure, actually. So you can drink them as teas. You can make tinctures out of them. I often prescribe tinctures. I think they're very powerful too, and it's sublingual. So it doesn't necessarily go through the whole process of the digestion that sometimes affects the absorption. But so there's so many ways that we can take these herbs and so many herbs to choose from.
Mm-hmm. So as a takeaway tip from this session, what would you recommend? What kind of tea someone should make out of this if it is really hot and they really want to cool down?
So hibiscus, I think, is a great tea to do that because it has like that tangy. It is sour, so you might want to mix it with some, something a little bit sweeter. But hibiscus is that refreshing taste, that summery taste. You can get dried leaves from the supermarket, or you can order them online. And it's just one teaspoon roughly to boil that in hot water and then let it cool. You can refrigerate it and drink it cold. So you can make like a lemonade out of it. If you want to add a little bit of maple syrup or stevia, you can add that too. And then it's just a fun drink for the summer.
Thank you so much for sharing the tea recipe with us. And thank you for your time and sharing all your expertise with us. We know that there is a lot of benefits that naturopathy can offer. And Dr. Mansi Vira is the new young naturopath who has recently started practice in New Jersey. I really appreciate your time and all your expertise that you provided to our viewers, and also sharing the principles of naturopathy, which is not just one modality of having one typical kind of treatment, but combining a lot of complementary and holistic medicinal therapies around. And as you mentioned, that partnership with your primary doctor is very important, because there are lab works that you need blood work done. You need to also share important points about if someone has a chronic disease and they are on certain medications. So there is a partnership with mainstream primary provider, physicians and doctors, nurse practitioners, and naturopaths, which combined together can bring beautiful results for someone who is really looking to take care of their ailments. So I hope our viewers have really enjoyed this session on TV Asia Telugu channel, this show in Healthline. I want to thank Dr. Mansi Vira for coming to this show and sharing your expertise.
Thank you so much for having me, and I hope this has inspired a little bit more interest and openness to naturopathic medicine.
Thank you, Dr. Mansi Vira. I know you for such a long time. I have seen you start your journey and continue it. I wish you all the best in your journey, and I'm sure many more people are going to be benefited by what you are offering.
Thank you. Thank you so much.
So I hope our viewers have enjoyed this session on TV Asia Telugu channel, this show in Healthline. I want to thank Dr. Mansi Vira for coming to this show and sharing your expertise.
న్యూజెర్సీలో ఇల్లు కొనాలని కానీ అమ్మాలని కానీ అనుకుంటున్నారా? మీ నమ్మకమైన నేస్తంగా మీ ఇంటి క్రయ విక్రయాలను చేసి పెడుతోంది మీ లోవి రియల్టీ గ్రూప్. వేలాది డాలర్ల మీ కష్టార్జితాన్ని, ఎంతో విలువైన సమయాన్ని ఆదా చేస్తూ కేవలం $990 నామమాత్రపు ఫీజుతో ఖచ్చితమైన సంతృప్తికరమైన లావాదేవీలను చేసి పెట్టే రియల్ ఏజెన్సీ లోవి. అంతేకాదు, మీరు కొన్న ఇంటి మీద మినిమం 1% క్యాష్ బ్యాక్ మీ క్లోజింగ్ కాస్ట్ లో పొందగలరు. మరిన్ని వివరాలకు ప్లీజ్ విజిట్ www.lovihomes.com. కాంటాక్ట్ 9083049621 or 9083371289.
Is test prep nerve-wracking? Getting an excellent score a huge challenge? A new wave in the test prep is here to help. Test Prep Pundits has all the answers to your questions. It is a one-stop solution for all your academic needs. Our premium online interactive content has hundreds of SAT and ACT test problems, hundreds of hours of videos. Get real and instant